A very good evening to all. I am Dr. Uttara Mohan from IP Digital Media team. We are streaming live on IP India YouTube channel for this webinar on the topic Movement as Medicine, Empowering Women Through Rehab Science with resource person Dr. Manisha Rathi. Before we start, I would like to briefly tell you about the IAP Digital Media team. This team consists of a group of physios who handle the Zoom platform, webinar live streaming, and IAP social media. We have the profiles of IAP on Facebook, Instagram, Twitter, LinkedIn, and YouTube. You can follow these profiles for updates about our upcoming events and also subscribe to YouTube channel for our live webinars. We'll be sharing the links for the social media in the chat shortly. This webinar is being organized by IP Women's Cell Maharashtra State Committee, which includes the State Coordinator Dr. Suvarna Ganvir, Joint Coordinator Dr. Snehal Patel, Sub-Coordinators, which includes myself, Dr. Uttara Mohan, and along with me, Dr. Priya Pawar and Dr. Nirali Sanghavi. It is my privilege to introduce our resource person for today, Dr. Manisha Rathi. She is Vice Principal and Professor at D.Y. Patil College of Physiotherapy, Pimpri, Pune, and Adjunct Professor at Swarnim Startup and Innovation University, Gandhinagar. She has completed BPT in Community-Based Rehabilitation from Pune University and PhD from D.Y. Patil Vidyapeeth, Pune. She has over 28 years of professional experience, including more than 25 years of teaching experience. She has authored more than 100 publications, contributed to chapters in several books. She has presented at her work at various international conferences. She has two patents and four copyright publications. She's been recognized by numerous awards, which includes Best Teacher, Best Faculty and Service to Profession Award. And she continues to always inspire students and faculties through her dedication and innovation. We are glad to have her here today and listen to her knowledge and insights on this topic. Now I request Dr. Manisha to please start with her presentation.
Thank you, Dr. Uttara, for giving me my introduction. I would like to thank State Coordinator Dr. Suvarna and Dr. Uttara Madam for giving me this opportunity to speak and to present my presentation today in front of all. Thank you, and kindly allow me to share my presentation. Is it visible?
Yes, ma'am, it's visible.
Okay. And I am audible also.
Yes.
Okay. Very good evening to all, and I'm starting with presentation. My presentation is on exercise as medicine, empowering women through rehab science. Now, first of all, I would like to wish you all a very happy International Women's Day. The theme of this year's Women's Day is Give to Gain. Now, what is to be given? Give power, opportunities, support, respect to any women, and I'm sure they will gain if you give them enough power. They will empower themselves in such a way that they will show what they can do. They can gain confidence if you give them opportunities. They will show what they can do in their best capacity. And if you support them, if you give respect them, they will be emotionally also very strong. They will get enough confidence, and they are going to be showing you what they can do it in the best form. So I'm again wishing you a very happy International Women's Day. Now coming to our topic, why exercise as medicine? Now, how many of you take medicine as regular for some problems? generally in community, generally in societies, many of the people take medicines. Why they take medicine? Maybe they are having some problems, like simple problems like hypertension, diabetes, or some respiratory problems, or some cholesterol issues, or some body infections. So they are taking medicines to get relief from various diseases, or they can take medicines to prevent diseases, like they may take some prophylactic treatment, or they may take some supplements, like generally we take vitamins, or we take calcium doses to prevent certain conditions or certain diseases. So that's why we generally take medicines. Then why do we exercises regularly just to prevent diseases, or prevent or cure diseases? Yes, we can do exercises for prevention as well as for the treatment basis. So we should see what are the benefits of exercises. So exercise is a most powerful non-pharmacological intervention which you can use to treat many conditions or prevent many problems in the life. Then recommended as a first line of therapy for many conditions. As we all know, many physiotherapists give exercises only for simple, even back pain conditions, osteoarthritis problems, even paralytic patients. And so physiotherapy or exercise become the first line of uh, treatment in many conditions. Then regular physical activity improves physical, mental, and social being. If you perform these exercises regularly, I don't think so you will need to there will be any need to take medicine. Then when you perform exercises, if you have any problem and you are performing exercises, it corrects biomechanically and reduces or prevents the problem from its base. So it just don't support the symptoms treatment, it treats the condition as a whole. So it's not if you have any pain, just physiotherapy de do, exercises de do, and it will be cured with that only. For that purpose only, it will be cured. So pain is getting relieved or range will be improving. No, it is not only that. Apart from these basic benefits, it will correct completely biomechanically, and it will see to it that it is not that problem will not occur in the future. So that's why exercises will help in curing to the maximum. And it is not a just lifestyle choice. Exercise, some people may think that I am going to the gym just for a lifestyle that choice, but it's not only for the lifestyle choice you should do exercises. You should perform these exercises thoroughly and from the core itself. And when you perform exercises, it improves quality of life. So exercises should be part of our regular activities. It should not be like when we are getting any problems, then only perform the exercises. Now, when coming to the women's health, we have seen many problems comes to women. Basic problems is and very commonest problem is osteoporosis and then arthritis. As we all are aware, if there is any hormonal imbalance, estrogen deficiency, which is seen nearing the menopausal period, the bone density reduces, leading to osteoporosis, and ultimately, then many joint arthritis also are developing. So, what is happening when these are the basic challenges women face? Then again, the pelvic floor dysfunction, which includes prolapse, incontinence, prolapse intervertebral disc also, pelvic inflammatory diseases also can be seen. So these are the diseases or the challenges any women face in her life. Then antenatal issues and postpartum recovery. Every woman generally goes through the reproductive phase, and then during the 9 months period of antenatal time and the perinatal and postnatal duration, she is undergoing through many physiological changes, and these physiological changes leads to many um, Certain times it can lead to complications, certain times it can lead to some issues, it may lead to delay in the recovery of the postpartum period. So these are the challenges women face. Then autoimmune and metabolic disorders. Obesity is very common metabolic disorder which is generally a women face, because after the menopausal period the estrogen deficiency is occurring, and that leads to changing in the basal metabolic rate, that leads to weight gain. So, and autoimmune disease also, women, certain autoimmune diseases are very common in females, especially rheumatoid arthritis. So these are the metabolic diseases or autoimmune diseases where women is facing uh, these challenges. Then menstruation, right from the age of menarche till menopause, she is undergoing through the menstruation phase. Even menopausal period, she is facing many issues like hot flushes, then psychological issues, then skin diseases or skin problems due to menopause is developing. So there are many problems she face or challenges she face during the menstrual phase or menopausal phase due to lots of irregular hormonal changes which are occurring in her life. Then certain cancers which are very much related to women's health are breast cancer, cervix cancer, ovarian cancer. These cancers are found very common, and breast cancer is one of the most common cancer found in a female. So these cancers, these are the challenges women face. And if we are aware about these challenges and perform the exercises from the beginning itself, and considering them that exercises are the medicine for preventive measures, then definitely we are going to empower us for not getting any problems, any diseases in the lifestyle, in the our whole life, and we are going to be a fit person. Then how exercises matters, why these exercises helps our body to recover. It reduces the risk of chronic diseases. So heart diseases, diabetes mellitus, cancer, which I told you just now, that these are the challenges. These challenges or these chronic conditions are going to be reduced with the regular exercises. If you perform regular exercises, it improves mental health also. Depression will not be occurring only, and there are many research happening that if there is regular performance of exercises, the chances of depression, anxiety, stress are reducing. Even cognition is going to improve with the regular exercises. It enhances quality of life. Longevity also definitely is going to enhance, and self well-being will be also enhanced. When you perform exercises, bone mass, muscle mass is going to improve, and it reduces fat. When you perform exercises, the fat weight is going to reduce, and the muscle mass and bone mass will be increasing. So your body composition is going to improve. So the if these body composition is improving, the chances of metabolic diseases development is going to be less. And with exercises, there will be ease in the antenatal period. If you perform exercises right from the second trimester, first trimester, there are you may perform or you may not, but second trimester and third trimester, yes, definitely you can perform exercises, and this will help in easing the antenatal period and enhancing the postnatal recovery. Now, till now we discussed what are the challenges and how it will help in our improvement of well-being. So it exercises, when you perform regularly, it boosts cardiovascular fitness. When you perform any movement, any exercises, the circulation demand is increasing by the muscles. So heart has to pump more and more blood, and there will be more metabolic changes which are occurring in the heart, and there will be more changes in the respiratory lungs occurring. So heart has to pump more with more force, so stroke volume is increasing, the cardiac output is increasing. So the chances of getting any problems to the heart and lungs will be reducing, and it will improve the cardiovascular, and respiratory fitness. When you perform any exercises, the hormonal balance is improving. There are many hormones which are there in the body. So, major hormones secretion is going to increase by doing the exercises. So, there will be increase in the cortisol level. Insulin production is going to increase, which utilizes excess sugar from your blood. So chances of diabetes mellitus type 2 especially will be reducing. Then endorphins is going to be released. If endorphins is going to be released with the exercises, it is a pain killing hormone. So pain will also be reducing. And there are many hormones which are um, producing more and more by performing exercises like growth hormone and all. So these hormones, if they are going to be released in an increased amount, your body balance will be maintained properly. Then exercises helps in rehabilitation of the person. If any person is disabled and person is unable to do activities, the person is not dependent, it is person is dependent on some family members, caregivers, then exercises will help them in rehabilitating and making them completely independent, and prevent women from specific problems. Like as I discussed earlier, there will be antenatal and postnatal problems. So these will be preventing by performing the regular exercises, the pelvic floor muscle strengthening exercises. If you perform regularly, you should not wait till the problem arises. You can start the pelvic floor exercises at the age of even 13, 14, 15 years also. So this will help in strengthening pelvic floor muscle in such a way that when the time comes, when menopausal age is coming, when the pelvic floor muscle starts reducing their strength, if initial strength is more, then they will not reduce to a great extent, and the problems which are occurring during menopausal age will be reducing. Then exercises helps in pain management and mobility restoration also. When you perform exercises, you are performing in the end range also, like in a complete range of motion exercises, like stretching exercises, strengthening exercises will help in mobility restoration also. When you perform exercises, confidence and self efficacy is increasing, social interaction also improving, because when you are performing exercises, you may perform in a group, you may go to a outside house and perform exercises, or you may go to gym. So social interaction is also improving, and when you are feeling well-being, when you are mentally stable, you are socially good, your quality of life is going to improve. Now, what are the various types of exercises you should perform so that you will be feeling in a very nice way? Like when you perform exercises, you should get all the benefits which we discussed earlier. So, there are many types of exercises which you can perform. One very common form of exercises is aerobic exercises. So, these can be a dance form of exercises, aerobic exercises. Even cycling is one form of aerobic exercises, Zumba. So these exercises you can perform. Now, what is the criteria or guidelines for performance of these exercises? You should perform these exercises for at least 150 minutes per week. मतलब at least 30 minutes per day for 5 days in a week. You should perform exercises, and that also not with just a gentle type of exercises. It should be a moderate to vigorous intensity. Now, how you calculate this moderate to vigorous intensity? You know the HR max, how you calculate HR max. So accordingly, you know what is your target HR and what is HR max. You have to calculate, and according to the Carbonans formula, you can get to know that what is your HR max and how much will be the moderate intensity and vigorous intensity. In the beginning, if your initial capacity of exercises itself is very less, if you find that your VO2 max is very less, it is coming to a mild form only, and you are having a very sedentary lifestyle, then don't start even your exercises with moderate intensity. Start with mild intensity, and slowly, within a period of 1 to 2 weeks, you can go for moderate intensity exercises that starts from 60% to 85% of HR max, so that you can do it. And then slowly you can increase. And there are many advancements in the aerobic exercises are coming, like intensive training also, or interval training also is coming. Circuit training is also available. So it depends on you what type of training you are choosing for performing these aerobic exercises. You can have, there are many researches going on, and have already done also and still going on, that even a high intensity exercises for 5 to 10 minutes in a day, at least twice in a day, or if possible 3 times in a day, but it should be high intensity exercise, will also be sufficient. There is no need to go for continuous 30 minutes exercise. If you don't have much time, you can just perform 10 minutes of high intensity exercises, and like that twice in a day or thrice in a day you can perform exercises. It will give the same effect to you. Then resistance exercises, again, it is very important. Aerobic exercises has different effects, which will help in improving the cardiovascular endurance and muscle endurance. But when you come to resistance exercises, it will help in building up the muscle strength. So that's why resistance exercises are also equally important. You can give strength training using the weights, resistance bands in the form of bands or tubes also you can use. You can use dumbbells, you can use medicine ball, uh, you can use even weight cuffs also, or simple weights also. So depends on availability of the material, resistance material which you are having. Sometimes even body weight can act as a resistance, and you can perform these exercises with the body weight itself. These resistance exercises should be performed at least 3 days in a week. Like aerobic exercises, you can perform 5 days or 6 days also sometimes, but resistance exercises should be performed alternate day, so that muscle soreness will not come. And at least 3 days in a week you should perform to get a best result. And alternate groups, muscle groups can be targeted every time. Like if you are performing one day upper extremity exercises, then the next time you can perform lower extremity exercises. So in this way, you can target different muscle group, and resistance training can be given to these muscle uh, groups. Okay. Then perform flexibility exercises, which includes various stretching exercises or yoga every day. Flexibility exercises for 5 to 10 minutes every day you can perform, but see to it that you are doing enough warm up before starting the flexibility exercises. Don't start stretching or overstretching without giving warm up to your muscles. So, stretching to which muscle? The most, generally, the most muscle, muscle which is mostly or commonly tight is hamstring muscle. TA tightness is also seen. Quadriceps tightness also is seen. So you can have stretching to these muscles. Even in upper extremity, you can have bicep stretching, tricep stretching, or pectoralis stretching. Shoulder girdle stretching exercises can be performed regularly. And trunk may you can have dorsolumbar fascia stretching. Again, it is equally important. So you can perform these flexibility exercises daily. Then coming to balance exercises, you can have Tai Chi, Pilates, or balance training, simple wobble board training also you can perform for balance. As age advances, once you reach to menopausal age and coming to a old age, then fall is very common in that age. So to prevent fall, you can have balance training. So perform these exercises also. You can perform either daily or alternate days also. Then very importantly is weight bearing exercises like running, walking. You can perform at least 5 days a week. weight bearing exercises are very important to load the bone. And if you are loading the bone, your bone mineral density will be maintained because your osteoblastic activities is going to be initiated. Even resistance training is very effective in maintaining bone strength also. So weight bearing exercises and resistance training you can perform for maintenance of bone health. And aerobic training and resistance training you can perform for maintenance of your muscle health. Aerobic training you can perform for maintenance of your fat weight in your body. You should not have excess fat weight. And flexibility exercises. So these are all the types of exercises which you must perform every day or as per the protocol which you are going to set in for your own or for your patients. Then coming to empowerment of women with the exercises, how you will empower a woman by performing the exercises. So the first of all, very importantly, you must understand there is no age limit. You can start empowering a women, or you can say empowering a girl from the age of teenage, adolescent age, and you can keep on empowering a woman till her old age. Why it is important? Because your exercises or importance of exercises you should not tell when she is in the age of 50s or 40s. You have to explain her the importance of exercises right from teenage. Nowadays teenage girls doesn't eat properly. They don't eat enough of calcium. They don't take much of proteins, so their muscle mass is less, their bone mass is less, and they are having more of junk food. So if at the age of 10, 12, 13 only, if your bone is not strong enough, how it will sustain in the old age? So you have to empower a woman at the age of teenage only. Educate her about her body health. Make them aware that what your body needs, what you should be doing for yourself. And you just not only make them aware about all the conditions which they may develop, you have to screen them also and find out, is there any risk factor present in them? If it is there, you can again further aware them about the yearly or 6 monthly screening for further awareness, or further find out any problems are developing or not. So it is very important. So empowering a women through education. Then self-management strategies. You need to empower her for self management. So she should understand how she can manage herself. So follow the timeline. This is very important. If generally you tell any women to perform exercises, she will first say that I don't have much time, I have to do these things for children, for husband, and for herself she will not get enough time. So you have to teach her how to get time for herself. Then plan diet protocol. So time or scheduling is very important for exercises. Then follow the diet protocol. She should equally give importance to herself, her own diet. Maintain discipline. Discipline, self discipline is very important. So you have to empower a woman with the help of these self management strategies. So you must tell her that if you perform exercises daily, you have to maintain a diary daily where you are marking them. Yes, I am doing exercises daily, which will be very fruitful in a later life. And you have to motivate her for the uh, daily performance of exercises, and you need to mentor her also sometimes, that you should make her aware, you should educate them further and further, you should motivate them, everything should be done. So these are all self management strategies for empowering a woman. Then you can have goal oriented rehabilitation strategies. Like if you have a patient with you and you want to empower that patient, or you would like to give some rehabilitation to that person, then first keep very small, small goals in the initial phase. Once they achieve these small goals, then go ahead with the long term plans. Don't just tell them in the beginning itself that this is the broad vision and you have to achieve it. You have to make them aware about how you can reach to long term goal, like from a small steps to a long one. So like that you need to go for goal oriented rehabilitation. And it is very important that it's not only one day that you need to empower a woman on 8th March only, that you teach her exercises and all, and she will perform with all highly motivated way, may only perform on 8th March or maybe 1 or 2 days more. It is a lifelong physical activity she should performing every day. So she need to take a pledge. Every woman should take a pledge, promise to self that yes, I am going to empower myself and I am going to do these exercises regularly so that in future life I don't have to take any medicine. So you must take a pledge that replacing medicine with the exercises, as far as possible, many conditions can be replaced with the exercise. Many medicines can be replaced with the exercises, but it's not completely replaceable. I can understand also, but wherever it is possible, you replace it, you prevent it, the occurrence of some diseases with the help of exercises. So in this way, you can empower yourself. So thank you so much for patient listening. So this is all about the exercises, how you can prevent medicine or exercises replacing the medicine.
Thank you, ma'am. It was very wonderful to have you with you with your informations. So I have the certain questions for you regarding that. So first question is, what are the recommended screening methods of for early detection of osteoporosis in women?
Okay. There for early detection of osteoporosis, there are many DEXA scan is there, which is really costly, but there are DEXA scan is the most common. You can use it for finding out the bone strength and bone health also. And even nowadays, even ultrasonography can be used as a screening tool. They generally do sonography on the calcaneum area and find out whether bone strength is enough or not. But for that you should have a expert sonologist in there, in your vicinity, then they can tell it. But otherwise the DEXA scan can tell you
Okay,
about the bone mineral density.
okay. There's one question in the chat box. Dr. Rita is asking if we continuously give any type of exercise 3 days for upper and 3 days for a lower extremity, will it give results?
Yes, definitely. You cannot, if it all depends what kind of exercises you are giving. If you're giving resisted exercises, yes, alternately you need to change the group of muscle. You cannot use only lower extremity for consecutive 3 days and then for upper extremity consecutive 3 days, because when you perform these exercises, muscle soreness comes next day. So
Mm.
there should be enough time for the muscles to recovery, and once the recovery is happening, alternate day you can perform and it will give the best result.
Okay. At what age should woman ideally begins the regular bone density assessments?
Assessments.
Yes.
Yes. Okay. Assessments you can definitely start from the, if you are at the risk, because there are the risk factors for osteoporosis also, like if you are having already some thyroid conditions, your bone density is reducing, or if you are not doing performing any uh, exercises, your lifestyle is completely sedentary. In such cases you can start from the age of 40. You can start assessing your bone mineral density at that age. But if you are regular trainer exercises you are doing, you are performing many weight bearing exercises, you can delay that up to 50 also, and after 50 you can perform. these screening measures.
Okay. What are
So
the role?
identifying risk
Yeah,
factors are important. Yeah.
yeah, true. What are the role for the genetic predispositions and family history play in the osteoporosis risk among women?
Yeah. It is very important. That is what I said, ki find out the risk factors, because if your bone strength is in your genetics is less only, is definitely there is going to be a bone mineral density less in the generations, future generations also. So it plays a great role. And
Mm,
yes, but if you are having good diet, if you are having good amount of exercises right from the early age, teenage, then that risk factors may be minimized.
mhm. How does the hormonal replacement therapy influence the bone health? Like,
Hormonal, okay. See, hormonal replacement therapy will specially used when there will be early menopause, or due to some issues, surgical menopause is needed. In that case, this hormonal replacement therapy is used, where estrogen and progesterone combination they give. So in that case, bone mineral density is going to be reduced generally, because of the estrogen. This I didn't get exact the question. Can you please tell me again?
so the question is, how does the hormonal replacement therapy influence the bone health? Like, what
So when
exactly
the
this is
estrogen,
do on
yes,
the bone? Yeah.
yes. When is, you know that estrogen is one of the hormone which influence the osteoblastic activity. So when estrogen is replaced during the hormonal therapy, uh, this hormone replacement therapy, the bone density may improve, but it won't improve drastically, but at least it will maintain, it will not further deteriorate. That is what is important. The moment you come to know that your bone density is less, you need to start working immediately, because bone density after certain age will not improve, but it will not deteriorate if you take proper precaution. So hormone replacement therapy will maintain whatever bone density is there at that particular time. It may enhance to some level, but not to a drastic level. Yes.
Okay. Thank you, madam. It was very nice. Now I would like to Dr. Nirali to do further things.
Good evening. Uh, Ma'am, our heartfelt gratitude to share your knowledge today with us, and it was genuinely valuable. And in a small gist, everything was covered. So, thank you for your time and sharing your valuable knowledge with all of us. I would also like to give my thanks to our President, IIP President, Dr. Sanjeev Jha sir, National Head, Dr. Ruchi ma'am, and our zonal head, Dr. Pooja Kamble, our state head, Dr. Suvarna Ganveer ma'am, our state joint coordinator, Dr. Snehal Patel, and our sub-coordinators, Dr. Uttara Mohan, Dr. Priya Pawar, and Dr. Nirali Sangvi, myself. And thanks to all the participants to spare your time today and, making our Women's Day special for us. Thanks a lot. Thank you, ma'am.
Thank you so much
Thank you,
once
ma'am.
again for
Happy
giving me
Women's
this
Day.
opportunity.
Thank you.
Thank you.
Thank you, ma'am.